will be set in a minute. Will be set in a minute. Good evening, everyone, and welcome to Medical Mondays with Dr. O. We have another exciting night, but this one is quite special because we have tonight with us one of our very best from Nigeria, Professor Dr. Dayo Faduyile. He is a professor at the Lagos State University College of Medicine, LASUT. He got his medical degree at the, I schooled here, so I have to get this thing straight. I always mix LASUT and Dr. Jagwezi Idiaraba.
Idiaraba, loose. Loose.
Yeah, I sometimes mix them. But he got his medical degree at the University of Lagos State College of Medicine. He loves education. He was not satisfied with being a physician alone. He went ahead to get his master's degree in cell biology and genetics, and then didn't stop there, proceeded getting a diploma of the National Cancer from the Division of Cancer Prevention in the United States. He passed with distinction the Diploma on Forensic Human Identification from the Academy of Forensic Medical Sciences in the United Kingdom examination. I can go on and on about Dr. Faduyile. Today, he is an associate professor at the Department of Pathology and Forensic Medicine of the Lagos State University College of Medicine. He is also a past president of the Nigerian Medical Association, and he was the backbone, I would say, and I think that would be the right word, for our esteemed, well-loved governor, we just passed, Governor Akeredolu. He himself now is running for governor of Ondo State, and I'm going to have the opportunity to say some about that later, because this is our brother that we need to be very excited about and to assist the best way we can to put him in office so that we can start having changes in Nigeria. So he's not only changing the scene of medicine, he's changing the scene where it matters, because whichever way we look at it, politics is what actually runs countries. Politics is what runs every area, makes every decision, makes the laws in education, in medicine, in everything. So it's making changes everywhere it matters. And we'll talk more about that. But we'll start with what we hear for first, medicine. He's going to talk to us about preventing cancer in women, talking about cancer in women, whichever way he wants to take it. But this is going to be an exciting conversation, and I'm sure we will learn a lot. So welcome our esteemed brother, Professor, and Dr. Faduyile.
Welcome.
Thank you very much. I'm happy to be invited here and seeing very great men and women in this platform. It's my pleasure to be here. And thank you for the citation you have just read. The only thing I will want to correct is that I have been a professor for about 5 years now. So you probably saw a CV that was not properly updated as it is. But by and large, that position is a call for opportunity to learn more, because by the time you become a professor, you suddenly know that you have learned very little. So today, what we are going to discuss is reducing the cancer burden in women. And I guess my time is 30 minutes or 40 minutes, so that I know how far I can go.
Take it and run with it.
It is important for us to know that as God has created us, there are constitutional differences between a man and a woman. And one of the major areas that we have difference between a man and a woman is in mammary gland, that is the breast. Naturally, the breasts of women are bigger than men and serves to actually nurture children that are born by women. Again, in our reproductive system, the woman has the uterus and the mouth of the uterus. The entry towards the uterus is the cervix. And the cervix is another area that we have a lot of cancer. We have other cancers that do affect women, which also affect men likewise, which is the colorectal carcinoma. That is cancer that affects our lung intestine. It affects both men and women, and it's about the third or the fourth cancer death burden in the people. Again, we have another cancer that equally affects man and woman, which is the cancer of the lungs. And for over the years, it has been found out that cancer of the lungs is actually related directly to smoking. And do you know what? Men are those who first started smoking right from the World War, in the First World War and Second World War. That is when smoking came into being. And about 30 years after, the havoc of that smoking started showing. We have a very steep rise of cancer of the lungs, especially in men, because largely this is the men that started smoking. And those who were selling cigarettes, tobacco, started showing it and making it more feminine. And in the late 60s, women folk started embracing smoking. And by 80s, the level of cancer of the lungs between men and women equilibrate. And again, the woman at a time was having more cancer of the lungs than that of men, until we now have stringent control of smoking. But the one that are largely affecting women, exclusive of men, is that of cancer of the breast and cancer of the cervix. I want to go to the cancer of the cervix first. Cancer of the cervix is one of the leading causes of cancer deaths in the world. For example, in Nigeria, the northern part of Nigeria, cancer of the cervix is the highest cause of death, of cancer death in our womenfold. And in the southern part of Nigeria, cancer of the breast is the highest cause of cancer death in a womanhood. But both of them are about the same percentage, just 1 or 2 digits difference. So the two of them contribute to over 80% of cancer deaths that we have, for example, in Nigeria. For cancer of the cervix, in the late 70s, cancer of the cervix was about the third cause of cancer death in even developed countries, like the United States, like the Australia and United Kingdom. And over the years, because they have started using the preventive mechanisms, it has been reduced largely, that it is now about the 13th, from about the second or third, now to 13th in the developed countries. Unfortunately, in developing countries and Africa, it's still ravaging a lot of our women. The first question that we want to ask is that what are the causes of cancer? Any cancer at all. It's important for us to know that science has not been able to pinpoint a particular cause for cancer. And usually, cancers are actually from the gene. It is from the DNA that we have that mistake, that once a cancer cell is made, then it starts multiplying, and we have no control. And the process of multiplication, it starts encroaching on the surrounding cells around that place and killing those cells. And after a while, they will develop strength and they will move from their location to other parts of the body. They can move from the cervix into the brain, into the lungs, into the spine, into the liver. And when they get to these new places, they start dividing without having control as they were doing in their primary place, killing those cells and making those cells not work properly. So, and that is how cancer does this very devastating effect, because it kills those vital cells and one will have a multi-systemic disease. So going back to cancer of the cervix, what are the causes of cancer of the cervix? Amongst all cancers, cancer of the cervix has been one cancer that has been confirmed to be a sexually transmitted disease cancer. And this is largely from an infection that is called human papilloma virus, HPV. HPV is ubiquitous. We have hundreds of serotypes that are everywhere in our body, around our body. And any sexually active fellow has one form or the other of the serotype of HPV. But as we have those HPV serotypes, these hundreds of them, we have some of them that we call oncogenic HPV. Those are the ones that can cause cancer, okay? And the types that can cause cancer majorly are the subtype 6, subtype 11, subtype 16, and subtype 18. These 4 HPV are about the cause of over 80% of all cancer of the cervix. So, in a nutshell, cancer of the cervix has been categorized as a sexually transmitted related to being sexually transmitted. So, how do we get HPV infection? I can tell you that between the age of 20 or 18 to 25 to 30, almost all women have been exposed to HPV infection. And they are usually infected by their male counterparts who also harbor this HPV infection. But it's not as if HPV infection itself is going to create crisis or problem for us, because the body immune system has a way of actually clearing this HPV infection. But in some people, the opportunity to clear it may not be that effective, and it will end up to start causing its deleterious effect in the cervix. While we are leaving that, we want to also say other causes of cancer of the cervix. It has been found that early coitus, early period of sexual activity in a woman tends to make them to be more predisposed to cancer of the cervix. Again, those of our women who has multiple partners tend to have more chance of having cancer of the cervix. And again, even if the women are pious, women who has a spouse who has multiple women outside, multiple sexual partners, tend to also have a high risk of having cancer of the cervix. We know some of the advanced countries where we have all sorts of interaction between man and man. Some of this HPV can be passed through the anal for those who had anal sex, or through the mouth for those who have oral sex. By and large, smoking has also been implicated in cancer of the cervix. So we have things that can be taken care of, that is modifiable. Part of them is to ensure that we stop smoking, and again, to remain with one's husband or one's spouse, if I have to put it that way. And again, for that spouse to also not having multiple sexual partners. These are things that have been seen that are associated with cancer of the cervix. And if someone wants to have cancer of the cervix, as we have been saying it, we have one good thing that God has put in place, that up to 10 to 14 years before the cancer comes, that fellow can see some of the warning signs, like we call the yellow card, if we watch football. And these are what we call the precancerous state. Precancerous means before the cancer comes. And one can see it up to 10 to 14 years before the cancer actually comes. So cancer of the cervix is still about the most friendly cancer that we can have, because it gives that long warning period. And the way you can know if you want to check yourself is to do a regular pap smear test. Pap smear test. This is a test that every sexually active woman should have at least from age 21, if they have become sexually active, or anybody who is from age 25. They should have a pap smear test. And this pap smear test is expected to be done once every year. And after 3 consecutive negative results, it can now be graduated to once every 3 years. And you can continue to do that. And if they are given a clean slate of bill, you are sure you are clear from having cancer of the cervix. And this is what has been done in developed climes, that today cancer of the cervix is in reality. Unfortunately, in Africa, most of our women are still unaware of this simple test. Pap smear test is a non-invasive test. It's a single day hospital visit that you can do it. Non-invasive means you don't need to prick a needle. You don't need to do a surgery. You just use a spatula to take some fluid around the mouth of the ovary, of the cervix, of the womb, which is the cervix. And they smear it, and the doctor looks at it. And if it is negative, they say it's negative. You come the following year for 3 consecutive negative before you start coming for every 3 years. And again, there have been an improvement. Like I have told you, it is a sexually transmitted disease where we have HPV that has been implicated. And we can now do a pap smear test where you can also check the HPV of that smear. And those who have negative results with negative HPV need not do every year pap smear test. They may do it once every 5 years. And I think it is important for us to appreciate that cancer of the cervix is kind to mankind, and nobody should have a reason to come down with cancer of the cervix. The question I want to ask us here is, for those of us who are sexually active, our mothers, when last did you do your pap smear test? If you have not done it, ensure you do it. Enroll with your practitioner, get it done. It's not painful, it is easy, it is a day procedure, and you come back and you get your results. And you can be sure you are not going to have cancer of the cervix. One important thing we should know about any cancer at all is that cancer does not present as a pain or with pain. By the time cancer now starts having pain, it has gone beyond. It's very simple cancer. It has gone very far. So it is important for us to know that until you do a test, you may not be able to know if you are having that precancerous state or if you are having obvious cancer of the cervix. I think that is by far cancer of the cervix. But now we have had a new development that has just come in. And the new development is that the HPV, I've told you about HPV, the oncogenic HPV, which is HPV 16 and 18, and these other 2 that are also creating genital warts and can also cause cancer is serotype 6 and 11. So we now have a vaccine that can be given to women so that the body can have immunity against this HPV. And the vaccine, we have the bivalent one that is only targeted against the 16 and 18. And we have the quadrivalent one that is targeted against 6, 11, 16, and 18. This HPV vaccine is usually given to children or ladies before they start having sexual activity, when they have not been exposed to HPV infection. And the reason behind it is that once you have given them that vaccination, they will develop immunity, that when they are now infected, they will not in any way have that HPV vaccine to stay within their body and cause cancer in them. It is believed that some of this HPV vaccination will still give protection for up to 10 years because it's still a new development and it is still being studied. So that is by and large the studies or the discussion I want to talk on the cancer of cervix. But it is important for us to still know that cancer of the cervix is still ravaging a large number of our womenfolk in Africa, including Nigeria. And it is largely because the government has not been able to put a lot into information, education, and communication to let the women know that they have to get a pap smear test done, as well as improve awareness generally of all the practitioners so that they can ensure that our womenfolk have this test done. I will quickly go to the second part of the cancer that ravages women, which is the cancer of the breast. The important thing we need to know is that the breast of women and the breast of a man, when we started in embryo, is about the same thing. But over the years, as we are born and our genetic makeup starts making the difference, the woman's breast now start growing bigger than that of men, for obvious reason. And it is in the process of becoming bigger that makes women to be more susceptible to having cancer of the breast than men. We have men also having cancer of the breast. I've seen a couple of them. But 99% of cancer of the breast are affecting the womanfolk. So it will not be wrong if we say cancer of the breast affects the women. And it is because of the estrogen, the hormone, that makes that breast to become enlarged during pregnancy, during breastfeeding, and it will have to constrict after those processes or during the normal cyclical menstrual cycle based on the estrogen and progesterone, which are the hormone that increases and reduces during the normal menstrual period. Without talking a lot of medical jargons, the important thing we need to know is that cancer of the breast affects large number of women. In the developed countries, the age that we see it tends to affect the non-white non-Hispanics more as age of 50 and above. For those of us who are of African origin, it tends to affect those of us who are of African origin at much earlier age. Okay, so, and it is because of our genetic makeup. So again, it is also important to say that in generality, it affects more Black American than the white non-Hispanics. And the reason is about our genetic makeup. But what are the important things we need to know about cancer of the breast? The first thing we need to know is what are the associated things that can be attached to cancer of the breast. Like I have said, most time there is no one particular known cause of cancers, any of the cancers. There are a group of things, and including the environmental factor, the way we live our life, okay? And it is important for us to know that all cancers have been related to obesity. Obesity is about being overweight. So when we're younger in this part of the world, by the time you are well fed and the whole body is protruding, they say, yes, this is a very good, well-fed child. But it is actually a malnutrition, and obesity has been pointed as one of the causes of any cancer, be it cancer of colorectal carcinoma, cancer of the lungs, cancer of the breast, any cancer, obesity has been implicated. So it is important for us to know that obesity is one of the major related factors of cancer of the breast. For the genetic makeup, any person that has fourth-degree relation who has come down with cancer of the breast is likely to have also cancer of the breast. I have told you about the race and ethnicity, that we tend to have cancer of breast at younger age in the Black American or those of us of African origin, unlike those in the Caucasian, non-Hispanics, which we usually see after the menopause, postmenopausal. Again, like I've said, as one grows older, the propensity of having a cancer of the breast increases. It has also been found out that those that has early menarche is the age of first menstruation of women. They tend to have increased risk of having cancer of the breast. Those who do not breastfeed their children tend to have increased risk of having cancer of the breast. Those who breastfeed their children for fairly a long time tend to have a reduced risk of having cancer of the cervix. Diet has not been found particularly to have direct effect on cancer of the cervix. However, exposure to some carcinogens are some chemicals that are in some of our food, especially the organic food that we take, has been implicated in why we are now having more cancers generally everywhere, because those chemicals tend to stay within our body and cause the havoc that we have. Like I've said, exercise is very important for our womanhood, and it is important that we indulge in exercise. I've told you about genetic makeup. We have some people who tend to have some bad genetic mutation or genetic makeup. Gene is what makes who we are. And we have some of them who have what we call BRCA1, which we call BRCA1, BRCA2. We have others. And those who tend to have those tend to have higher risk of having cancer. But how do you know if somebody is having cancer? It is very difficult until you get to test. And the test that it is easy for us is for us to do what we call breast self-examination. All our women are expected at least once a week or once in a circle, stay in front of the mirror, raise up your hand, look at the level of your nipple, check if one is higher than the other. Yes, it can be higher than the other if you have used one part to breastfeed more than the other for children. But if it is retracting, you can now know that there is something underneath. Look at the texture of the breast. Then you palpate. You divide the breast into 4 parts. You palpate the one upper inner, the one upper outer, the one lower inner, then lower outer. You use the palm. Don't poke, because the breast has it's not smooth. So just use the palm to apply. And if you feel any mass, quickly go and see a doctor so that they can check you out. But for those who are in developed countries, we have what we call mammogram. Mammogram has been a very good tool that has been used largely to detect even cancer that is as small as 0.5 centimeter in diameter. So by the time you have to do your breast self-examination, or you have consistently followed the doctor's advice to do a mammogram, and they can pick it up, lo and behold, at that time, we can still do excisional biopsy and take out that cancerous portion. And such women can live a very good, healthy life thereafter. Unfortunately, many of our women folk are not even doing ordinary breast self-examination, that you don't need anybody. It is only you who will do it. If they do it and they do the normal palpation and they can get it, they can live normal life. But what we see in Africa, where we work, we see advanced cases of cancer where it has gone beyond even the nodule. Now that it has become ulcerated, it has become a wound. And I can tell you, a cancer that is about the head of the thumb, as small as it could be, is already a bad one, because it most likely must have gone to other parts of the body, which we call metastasis. Cancer of the cervix, cancer of the breast are the 2 leading causes of cancer deaths amongst our women folk, and luckily, both of them can be picked early, can be prevented, and can be treated appropriately. So it is important for all of us to work together so that we can start reducing these cancer deaths amongst our women folk. Thank you very much.
Wow. Thank you so much. Wow. That's a whole lot of education. Thank you. I wanted to add something. You know, it's not funny, and it could be funny, but when you were talking about HPV, human papilloma virus vaccine, I couldn't help but remember a patient of mine who I've been telling her that our children need the HPV vaccine. We give it to men, to boys here also. We start at the age of 9. We give it to boys and girls. And she kept refusing. So one visit she came and I broached it again. And then she told me, she said, if our daughter gets this vaccine, she will become promiscuous. She'll just be sleeping with men around. And so I had to take the time. I'm like, okay, now let's educate you on this. It's very important to note that we don't know where our partners have been. You don't know who the person your child is going to marry, who they have slept with, and what they have. So when they get this vaccine, both males and females, then it protects them. So if their spouse in the future has contracted HPV, which they won't know they have, they cannot infect them again. She got that when I said it the way I just said it. And she said she's going to tell every woman, every man in their church so that they can get their children vaccinated, because they all had conversation that they were not going to do it. So thank you so much for talking about that. I just want to share so that we can spread the word. The vaccine is very important. It can save your daughter's life, even your son's in the future. So I have somebody who is Samsung SM. If you please unmute and please introduce yourself because your name is not posted. Kindly unmute. Kindly unmute. Thank you.
Thank you very much, ma. I'm your same cousin, Professor Akitana.
That's my cousin, all the way from Nigeria too.
Yeah, yes, ma. Yes, ma.
He's calling in from Nigeria. He's also a professor of Greek, a doctor also. So go ahead. Your question.
It's a pity, it's a regular thing in Nigeria that there is no light. So I'm on solar, so you can't see my face very well. Thank you, Doctor, very much for this very inspiring, very informative and educative presentation. In fact, I really appreciate your eloquence. In fact, I was looking at it deeply, whether you are talking to the paper or you have anything written that is like you are just talking offhand. Yes. Thank you very much, Doctor. And I'm proud of you also being a Nigerian and somebody from Nigeria as well. So I think I'm not the only one here. My question, you were talking about breast cancer and cervical cancer or cervix. Pardon me for the language.
Yeah,
I'm not
cervical cancer. Cervical cancer. Yeah, you got it.
One, you said there is no particular cause attached to it, but you mentioned some signs that we can observe as obesity, principally obesity, which in Nigeria or in most African countries, we believe is an evidence of good living. It began to be scaring for me now, because the way I perceived it before was that when you have, but for most of our young girls that are virgin, can this test, this HPV vaccine, be applied at that tender age? Or can they go for that test? Because as a virgin, I had a problem with my daughter sometimes before she got married. She was a virgin. And to carry out some tests, I was afraid that I don't want something to happen to her that, the spouse will now have a wrong notion of what she is all about. Please, how do we, as a preventive method, can it be given to virgins? That's the first question. Two, you said as the female girl child begin to experience maturity, they have more propensity to this cancerous thing. Can food, the kind of food we eat, because in the course of your discussion, you said our genetic makeup goes a long way in determining this thing. Can it also be corrected through food or the environment that we are? Those are my two questions, please. I'm not too sure whether you got it clear.
Yeah.
Thank you very much, ma'am.
Professor Faduyile.
Yes, thank you very much.
Pap smears in virgins.
Pap smear is not indicated for virgin. It is actually to be given to a female who have started having coitus. And you can't do it on virgin naturally because you may not be able to go through the hymen to get it to the cervix. HPV is to be given to virgins, both male or female. And that's why it is not advisable, but they still give, but it's not advisable to give HPV vaccine to women who had sexual coitus. And the basis of giving them before sexual coitus or exposure is because in HPV, once you give that vaccination, what that vaccine does is to strengthen the immunity of the host so that when that infection comes, it looks as you have given that person a door that can shut it against that infection, that HPV. But if you have opened your door and HPV is already filled into the house, and you are now saying you want to give a vaccine to close the door, you are not doing anything because they are already filled up in the house. So that is about the basis of how I can explain. If we want to explain how the role of vaccination, the process of vaccination is another long period. But HPV is expected to be given to children, both male and female, before they have this opportunity of sexual interaction. Yes, if we know how many division that occurs in a cell every day, it runs into millions. And in this cellular division, there are bound to be mistakes. And once mistakes come, if the body does not have ability to correct that mistake, then we will have one cell that has gone through the circle of division that has now acquired that mistake. And that mistake may be a mistake that will not make that cell to listen to control. And immediately it cannot be controlled. It starts having its own offering, and you start having rascally cells. And these rascally cells are what we call cancer cells. They don't obey any order. They grow, they crowd this place they grow, they kill the cells around where they grow, and they leave that home. They go to other parts of the body and start killing those cells. Okay? So we have some people who have some genes that cannot make them correct some of these mistakes in the millions of cell division that we have every day. Those people tend to have more cancers than ordinary people that you have proper genetic makeup that you can use, you can stop once we have a mistake, kill that cells so that that cell cannot reproduce itself. So, but as we grow older, those power reduces, those control reduces, and we tend to have cells that can actually escape that control. And that is why generally, as one grows older, one tends to have more propensity of having cancer. So age is one thing that has propensity of having cancer. There's nothing anybody could do about it. But most of the time, we still have good control that even we don't have. Again, you said, can it be through food or through, there are so many, when we say we don't have a cause for cancer, the problem is if you have mosquito bites and the mosquito injects the cause of malaria, which is called plasmodium. We know it is that plasmodium in your body that will now give you malaria. So we know the cause of that malaria. If you kill that plasmodium, then you will not have malaria. So we have a cause and we know the effect. But for cancer, we don't have a cause that this is the thing that certainly will cause cancer. But we have other things that they stay together: environmental factor, stress factor, and if you live in a place that you have more ionizing radiation, it tends to conglomerate together and can cause that cancer to come into play. It is not everybody who has some of these bad genes that end up having cancer. It is not everybody that is exposed to this food that are chemical infested that come down with cancer. So there are so many things that comes together that will make someone to have cancer. And that is the reason why science will say there is still no one particular cause that you say cause and effect that you can say causes cancer. So it is a lot of things that come together. And yes, if we observe some of the precautionary means, I can tell you some people who may be predestined, if I have to use that word, to having cancer may never have cancer. But if you are a person who smokes, smoking increases oxidative effect. Well, I don't want to say medical jargon, but importantly, when one smokes, it creates more chemical that can create more problem for such person. So that one can help some of those defective genes for that cancer to start. Once somebody is obese, obesity will make that person also to have oxidative stress. And it is this oxidative stress that tends to increase the redox, I don't know how to say, things that can make somebody to have cancer. So all these things are not, it's not all people who are obese that end up with cancer, okay? So there are some other things that are added together that makes people have cancer. But if we correct our obesity, we know that the propensity, the chances of coming down with cancer will reduce drastically. I think I've answered all the questions. Environmental factor has a lot. And for example, the Hiroshima and Nagasaki bomb blast, years after, they have all sorts of cancers around that Japan area. And it is because of that ionizing radiation for those who survive those nuclear bomb at that time. Thank you very much.
Before you go on that, I still have one other thing. One, I said, how much does our diet style, control these two types of cancer that you mentioned about? Particularly, most of the fruits that we have now are artificially breeded. You understand? We hardly have natural fruits now. Actually, in Africa, we still have some, but there are some specially bred fruits. Like you have the mangoes, you have the carrots, you have these that, they add some fertilizers and some special chemicals.
Seedless oranges. Seedless oranges.
Oranges, you understand? And those things are in the market. You go, you buy them, you take them, and some of the junks that we take, to what level do you think that can really expedite this cancerous thing in us, or do we avoid them totally? Thank you.
Well, the research is still largely here or there, not here or there. Many of the organic foods have been seen that they don't have carcinogens in them, but over the years, it has been found that some of them or some of those people who indulge in such food tend to have cancer. So it has not been fully proven. And when you have a cohort, you have to follow that cohort for up to 20, 30, 40 years for you to be able to boldly say, this is the cause and effect. And I don't think organic food has been up to 40 years. I stand to be corrected, please. But I think organic food is just a recent thing in the last 20, 25 years. But we have some people who are coming that, yes, it is increasing those cancer risk, which to me, I believe, yes, but it has still been found that it has not been proven that they are significantly causing increased risk in cancer. If it has been found out, they will have moved to stop those organic food. But it is safer for you to eat food that are produced normally. But even where do we have those? Even our proteins today are not organic, are all artificially made. And that is why we have a lot of noise about the vaccine for COVID in recent time, where the protein was manufactured. But I think the world is improving. We tend to know it more as the year goes by. But most fruits help in reducing oxidative stress. And when one takes good fruits, vegetable, one tends to have a lot of resistance towards having cancer.
Thank you very much, sir. I'm grateful.
Thank you. Thank you.
Thank you. Auntie Tower, kindly unmute, ma. Thank you, ma. Welcome, ma.
Thank you. Good evening, everyone. Thank you very much, Professor Faduyile. Sorry for that. When you made your presentation, you did a good job. Thank you for all the information you gave us. But you're welcome. I want to talk about the lung cancer because I have a friend and she's very young. She has never smoked in her life. And she came up with lung cancer. Though right now she's under remission, she's under 60. But when she told me, all what I can deduce was, and whoever on the platform, I'm sorry for the comment I'm going to make. I don't mean anything bad. She's a celestial woman. And when they do their harvest, they always invite me. And when I go, I have to get out of their church because the way they do the incense is just outrageous. So she's a wife of a pastor, celestial, but she never thought of it. When she talked to me, I said, are you sure it's not your church, all those incense? And he said, oh, I never thought of that. Can that cause the cancer, or am I just having something on my head? Well, and also our four parents, my grandparents, when we used to stay with her, we use firewoods and we blow it with our mouth, and all those smoke, we inhaled it. But they were not coming up with all these lung cancers they are coming now. So what's the difference between that time and this time?
Thank you. I want to, Professor, there's a question in the chat box that goes.
If you want me to answer that, answer this.
No, I'm going to let you answer it. I just want to add this one so you don't have to repeat. This is my sister, actually, awake also in London. She said she has met 2 non-smokers with lung cancer. One a male and the other a female. So in the same lines, I just wanted to have you answer those together. Thank you.
Well, thank you very much, ma. Number one,
You're welcome.
there has not been any study that can confirm that the incense has carcinogenic effects that can make such people have cancer of this lungs. Again, we have had so many people who have come down with cancer of the lungs and they are not smokers. So it is not all cancers of the lung that are related to smoking. But if we have a cohort of 100 cancer of the lung patients and you ask them, 80% of them are smokers. And if you take non-smokers of the same age, of the same group if you follow them, you see that amongst those group of non-smokers, you may just have about 3 or 4 of them who come down with cancer of the lungs. So in this group of smokers, 100 of them, in this group of non-smokers, 100 of them, you follow them for 20, 30, 40 years. And the non-smokers, about 4 or 10 of them has cancer. In the smokers, about 80 of them has cancer. Will it be right to conclude that smoking has relationship with cancer? So it doesn't mean that if you do not smoke, you cannot still have cancer of the lungs. But if you smoke, the likelihood of having cancer of the lung is high. And most smokers still go down with cancer of the lung. And we have many smokers who live good life to 120 and they do not come down with cancer of the lungs. So it's not a straightforward thing that you say, okay, if you do this, this is what happened. I gave you about the history of cancer of the lungs. It started in 1921, 1935, during the First World War and Second World War, when the military started smoking to have some heat around them. And they took it to the house, and it is for men. And if the level of smoking in the population is 2%, in 10, 20 years, amongst the male, it moved from 2% to 30%. So they can trace that smoking, and those people who went to 30% are majorly smokers. So when they get to 30%, and men started dropping it, the manufacturer of tobacco started sending that message, advertising to women. And women started taking it up in 1960s, late 60s, early 70s. And by the time it got to 80, 90, the thing has also peaked among the women. Meanwhile, the men were coming down. So it's confirmed that smoking has relationship with cancer of the lungs, but it is not correct for us to say it is only smoking that causes cancer of the lung. We have a celebrated man in Nigeria who never smoked, actually died from cancer of the lung. So it can happen. And the truth about it is that there is nothing you can do to protect yourself or whatever that you cannot have cancer. There's nothing. It's not as if that you don't smoke, you don't drink alcohol, then you cannot have. We have people who don't drink, who are pious, who are everything, and they come down with cancer. And we have people who are wayward, who has done everything, and they live a good life all through, and they don't have any illness. So multifactorial system, multifactorial reason are things that come together to cause cancer. And for those who have seen non-smokers having cancer, yes, a lot of things can come, genetic makeup, some chemicals and some other things can also make such person to have cancer, even of the lung, as it could be. I think I tried to answer that question.
I think you did.
Much.
And Aggie said again in the platform that anti-tower, they probably did have cancer from the smoke of the wood fire, or the firewood, but probably attributed it to dark arrows for lack of knowledge.
That is very correct. That is very correct. And again, we have one thing that we call scrotus cancer, cancer of the scrotum. And it was very common among chimney cleaners in those age that we don't have warmers, and they put firewood to warm the house. And we have men who clean the chimney because that is their job. They tend not to clean themselves, and a lot of this charcoal come to their body part and they stay there. They are used to it. And at those times, they found out that many of them come down with cancer of the scrotum, and it is actually from charcoal. So when they stop that, then cancer of the scrotum reduces. So charcoal, ordinary charcoal, can also cause cancer, But like what you have said, a lot of dark arrow, a lot of superstitious things come around, and you don't know where it comes from.
Yes, thank you. Thank you, Abby. Dr. Jagwe, kindly unmute and ask your question. You're muted. You're muted, sir. Thank you.
Thank you again for the presentation, Dr. Faduyile. Well, I was going to talk about the chimney sweeps as those people that you just mentioned, cleaning the chimney. That's very good. Thank you for mentioning that. I was also going to mention something about the secondhand smoking that was never mentioned. I've read, maybe, it wasn't a scientific publication, but at least I know I've read somewhere that says that people who are exposed to secondhand smoke tend to become more prone to developing lung cancer than those who actually actively smoke, because those who actively smoke have a way of blowing out most of the smoke than those who are inhaling the secondhand smoke. So I just wanted you to mention a little bit about secondhand smoke in relation to lung cancer.
Well, thank you very much.
And hold on one second. And then the next thing will be, you were mentioning things about oxidative stress. And you mentioned something about the fruits and all of that stuff. I think what we really need from all those vegetables and fruits are the antioxidants. And so once we can have the antioxidants as part of our meals, the radicals, the free radicals that cause predispose cells to having cancers can then be neutralized by the antioxidants.
Well, thank you very much. I sincerely wanted to break it so that I don't talk so much jargons. You said antioxidants and you said oxidative stress. So the treatment of oxidative stress is antioxidants. And we have antioxidants from the fruits, the vegetable, and that is why it is good. And you are correct, sir. And again, the passive smokers, they are more at risk than even the smokers, because when you see smokers, they have this top at the back. And if you see those one refine and actually stop some of the chemicals that can be very injurious from being part of those that is inhaled in that section.
It's called filter. The filter.
It's an eye filter, yes. So those who are actually taking the raw one tend to have higher risk. But even unless you stay with them in the house and they smoke every time and you are staying with them, if it is casual one, the exposure may not be that much. And in very developed countries today, they actually give places in which you can smoke. They are banned smoking in open places just to protect people like that. And I think it's the right thing and it is very correct. Those who are spouses of those who smoke tend to have those high risk from being a passive smoker or secondhand smoker. I agree with you, sir.
The other thing I wanted to mention has to do with okay, I'll remember, because I was just about to say something when you started talking. So that's fine. Thank you so much for your answer.
Thank you. So here we have Madam Lara Okunubi. We favoritely call her Madam VP, Madam CEO, from NAPAC, Nigerian American Public Affairs Committee. Prof, I told you about that. So you have your hand raised, ma. Kindly unmute.
Thank you, Dr. O. Looking good. I don't understand how Dr. Ajako should be speaking before me.
You know, I don't get it. Did you see how, you know, I think I just missed seeing your head.
Professor Faduyile, good afternoon, sir. Thank you for the wonderful deliberation. Well, just a minute ago, Dr. O was talking about these seedless oranges. And, you know, this is something that is highly marketed. Seedless grapes, seedless watermelon, seedless oranges. Are these things, are they bad? But we think we're eating fruits. So these ones that are classified as seedless, are they also antioxidant or they're just fake?
Okay, genetically modified fruits. I have said it. I said it's for any scientist who wants to say something, you must have done enough research and confirm. It has not been fully confirmed, but there have been one or two people who have come down with some diseases. And if we want to do research, maybe I should just explain so that most of the time, it is not one happenstance that will make you to say there's a causal relationship, that there's a relationship. It's not one happenstance. In Africa, or in those who are not scientific in nature, once you have just one occurrence, say, yes, certainly it is because of this. Like we have said, we say smoking can cause lung cancer, and that is generally accepted. But they have asked me a question, and I have said, even no smokers can have lung cancer. So if we have a no smoker who has lung cancer, you can now say, no, everybody, either you are smoking or you are not smoking, you can have lung cancer. But I've made an analogy of two researches when you have a cohort study for over years, and you can see a significant difference in the two population of the incidents that can make you come to a position that, yes, it is true that there is a relationship between the test and the standard, if I have to use it that way. But importantly,
so I'm sorry to interrupt you, sir. My question was not whether they cause cancer. My question was in the effectiveness, because we're talking about antioxidant, and
they have antioxidants. They are fruits. They have antioxidants, but they can give another thing. We have some drugs that you take. We have some drugs that you take that can give another thing. Okay, so the thing is how safe it is. The question is, on other diseases, we may not be able to say all the safety level, but it has been found that it is safety, and that is why people are taking it. But we have some people who are a little bit careful so that they do not just get into a position of exposing themselves. But we have to be careful so that we don't just use one index case or two index cases and use it as generalization. That's what I'm saying about that.
Okay, sir. Thank you.
Is your question fantastic? I'm coming back. Oh, I'm coming back to the NEPAC family. So, because we have to connect with our future governor. I have next. See, Auntie Lara, we just spoke, is our mama, foundation mama at NEPAC. Dr. Nelson Aluya is our national president for NEPAC. Kindly unmute. You have your hand raised, sir. Dr.
Hello.
Yes.
Good evening and greetings from New Jersey. Always a wonder to be here. And thank you so much, Prof, for such incredible talk and for bringing and making this really easy for most of us to understand as well. And of course, once again, thank you, Dr. O, for making this thing possible. Every step we take every day is to help us address the issues that really concerns us and how well we need to fix them. But the only way to fixing this issue is by being informed. And like we always say in NEPAC, get engaged, get informed. So for those who came on today, they've engaged and they've been informed. So for a few things, my background, Prof, I'm medicine and pediatrics trained, assistant professor at the New Jersey Medical School. So I've held a couple of positions here and there. Now, cancer is very big and paramount and dear to me because having worked as a chief medical officer for Federal Health Qualified Center, I had to overlook the risk of cancer in our community that was so big. But I have a little contribution and I have a question for you. Now, the question is in regards to some of the things I'd noticed way back in Nigeria before now, and the variations from the north and the south. But before I go on to that, talking about lung cancer, one of the questions I often hear and people talk about again is, hey, I never smoke, or I know someone who never smoked all their life. Now they have lung cancer. How can you explain that? But to give a little short summary of that, lung cancer has been grouped into two types. There's the small cell lung cancer and the non-small cell lung cancer. They are named in that format based on the way they look at when they look in the microscope. Prof, I know, understands that. The way the size and the shape, what it look like in a microscope. Now, majority of the cancer, usually 80% of them are the non-small cell lung cancer, while 20% are the small cell. Now, for those who don't smoke, statistics here in the US, I know, but globally, well, especially where we come from in Africa, because I love statistics, I love to give those numbers. We need to know those, and that's where Prof will come in as well, or what you guys need to do in Nigeria. 10 to 20% of individuals here in the United States have who never smoke, have non-small cell lung cancer. And of that type, there's the adenocarcinoma. But the unfortunate thing with that is the non-small cell lung cancer tend to spread really fast and you don't see it early. Now, for those who don't smoke, it's commoner in women than in men. However, women tend to live longer than men who don't smoke who have lung cancer. So those are the stats. The average age of one which they live, on the average, for women about 10 years, for men about 7. So these are the statistics and these are the things you see, and people often come up and ask those questions. But the question is why? Why is that happening? For some of us who've heard some of the things we talked about before, the environment, epigenetics is huge, 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 huge. It doesn't change how the environment, meaning the food, where you live, the way you work, everything else. It doesn't change your DNA, but it changes how your DNA is expressed. And that's what they call, there's an entity, especially for non-small cell cancer for those who don't smoke. It's called, I think, EGFR, the epidermal growth factor receptor. Right. So those linings in the walls of the lung, something triggers it, that the cells begin to change and affect itself. Are there people with genetic modification that are risk for it? Yeah, probably. But then it's like a double whammy. If you're at risk and you now in an environment, maybe you live, for those who live here in the US, you live in the basement where there's radion. Because, you know, for those who live in the basement here, there's a chemical called radion. They tend to usually screen for that. And you have that risk, then, you know, it really increases. Wood ash or wood fumes have been associated with it as well. So when my sister talked about the incense and all that, who knows? You know, like you said, nothing's been shown but that, but who knows, unless we go on to start investigating. Now, the question I would ask, that's for another day, in that respect. How many people who are in the celestial or cherubim and seraphim who burn incense every day, how many of them come with lung cancer? Have we done those statistics? No, nobody's ever looked. You understand? They just say that's, or black that's. These are where we as people need to stand up and somebody say, you know what, let me look at this small cohort of people and see how many of them truly do get lung cancer. You understand? So, but coming down to where I will have my question for you, Prof, is on cervical cancer. Cervical cancer and breast cancer, especially cervical cancer, in fact, like you said, the most friendly cancer we have right now, because it's very preventable. Globally, I think, what did they even say, Seth? About 600,000 people tend to have cervical cancer. Maybe about 43,000 of them will die. It's still a big issue. Here in the US, about 40,000 is found every year. 2,000 will die. Now, because of the steps, like you rightly said before, vaccine, screening, and all that. Of which the federal government here is pumping a lot of money into that now. So screening is the key, no doubt. Now, for us back home, we need to take those steps. And that's why you, as a prof, where you're doing, advocating for that. And those of us in the diaspora must advocate for that. I see no reason why NAPAC, I know Dr. O will kill me, but she's the head of the medical team, where we just save some money and send to some doctors back home and do an outreach to screen thousands and thousands of women. It won't cost that much money. For those who are on the panel listening right now, we can also do that. We'll ask for some money where we can pay for a number of women who have been registered. I would pay for them to have their screening, because the people who will screen and take care of are our people as well. Now to my question, Prof. You did mention that breast cancer is a higher number of deaths for women who live in the South, but for those who live in the North, it's more cervical cancer. The question is, why? There have been postulations here and there, and I've seen, if I schooled in ABU, and one of the things that used to trigger me back in the days, especially when we went for rural training, it's called Mulofashi, when we do our community outreach.
You are muted.
Right. I saw women who were still breastfeeding their babies, carrying babies. But on one side of the breast, you can see through fungating mass. And I used to wonder, what the heck is going on? These women, meaning they were still in their 20s, in the North, and of course, cervical cancer as well. So why do you think this proponent variation occur in the North as in the South, for those who have seen that? Yeah, I see ABU Alma Mater. Yes, we're here, we're representing. Thank you, Prof.
Yes, I'm here too. I'm here on ABU.
I'm also here on ABU.
All right. We own the house.
School.
Your ABU alma mater, my sister, is in London. The one who, put that in the chat box.
All right.
Yeah, she went to ABU.
Abby is from ABU.
Yes, ma.
Abby, you need to relocate to Los Angeles, Joe Mabo.
ABU
Got
alumni.
you. I
ABU
agree.
alumni is in Atlanta, headquarters of ABU alumni.
Okay, I'm going to step down from that one.
Well, thank you very much. I agree and I adopt what you have said about cancer and the lung cancer. Specifically, the type of lung cancer that is associated majorly with smoking is squamous cell. And like you have said, we have so many types. We have old cell, we have the small and not the small. Again, we also have the one that is not within the lung parenchyma that we call mesothelioma. Okay, that is the pleural cavity. And all of them, we have different types. There are so many. Cancer, even within cancer, when we say breast cancer, it's not a child, one child. You have breast cancer, we have lobular, we have ductal, we have papillary, we have all sorts of that. Even within ductal, we have different shades. So it's not just straightforward that it's just one cancer. I adopt what you have said and I agree with you. One of the causes of cervical cancer is early menarche and early coitus, early sexual experience.
Early starting menses early and starting to have sex early.
And you can see that distinction between South and West and the North. Okay. By 11, they are being betrothed to a man. And again, the lifestyle in the North, the men have multiple sexual partners. Thirdly, it is also important for us to know that the education, the access to health, it is better down south, generally, at least averagely, than the north. But for breast, which has nothing majorly to do with your lifestyle, menarche, sexual orientation, sexual exposure, and other things, they tend to equilibrate. But because especially of this extra frame, I think that is what makes the north to have more cases of cervical cancer than those in the southern Nigeria. That's a simple answer that I can give.
Right. So, Prof, not to cut you, there's this, what do you call it? Inference that was also allegedly associating, the spread of cervical cancer, especially the HPV, in uncircumcised men. What's your take on that?
That is true. It's one of those things that has been seen to increase the transmission of HPV, uncircumcised. And we have more of them in the northern, as well
right,
as amongst the Indians.
Right.
That's true.
So circumcision, when the Bible preached circumcision, there was a reason behind it. It was not just because God
always
saw
right.
a reason.
That is always right. So Dr. Aluya and Dr. Jagbesma witnessed in 2018, we did a lot of pap smears on women, but that was the last one that we did. We need to revisit that. You're right. And, it does take funding, but we were able to successfully screen lots of women then. So, Dr. Jagbe.
Sorry, before Dr. Jagbe, there is a question in the chat box.
Oh, no, we're coming back to that. Oh, you have questions there. We have the people who raise their hands have advantage. Unless there's a question that I can tie together, I'll quickly do it. Yeah, Dr. Jagbe, go ahead, sir.
Yeah, I was going to talk about the child bride issue of the North, in which case little children are married off to men who have already many more wives. Dr. Aluya probably just mentioned similar things right now. So that's something I was going to raise up earlier regarding the cervical cancer propensity in the northern part of Nigeria. Now, I'm sure it's not only in northern part of Nigeria that you have the child bride practices, in which case little children are married off, to older men who have other wives and maybe other concubines. So that is something, that definitely needs to be investigated. So there's so much room for research activities to actually map out what our situation is in the populations that we represent. So that's one. The other thing I was going to raise was the topic tonight is reducing cancer burden among women. I know this may be a little bit touchy. Many women want to look very beautiful, but they are constantly using skin lightener or bleaches, and they do not use sunscreen on their skin, and they are constantly in the sun. What do you say about that? Because if you are reducing the burden of cancer in women, it's not just breast cancer or cervical cancer that, women are more prone to probably having. Can you say something about the skin lightening and the propensity to having skin cancer, like melanoma and stuff like that?
Well, thank you very much, sir. I just chose those two because they are the big guys amongst the cancer death in women. But the truth about it is that in this normal white light that we have a spectrum. We have a spectrum of light from ultraviolet, infrared, and different wavelengths. All of them become this light that you see that everything looks light, normal light, but we can actually break them into different wavelengths. And it has been found that ultraviolet rays are carcinogenic. They can cause cancer in human beings. But God has helped those of us in Africa that we have melanin. Melanin is what makes us dark, black. And this melanin has a way of stopping that ultraviolet rays to enter into our body. And once it cannot penetrate into our body, then it cannot cause the havoc. And those amongst us in this part of the world where we have a lot of sunshine, when you now have the albinos have what we call albinism. They don't have melanin pigment. And if they get exposed into the broad daylight, those ultraviolet rays can actually penetrate and get to the deeper part of the body. And they tend to have more of skin cancer. They can have melanoma, which is a skin cancer that it is common amongst them. We have other forms of cancers that can be seen, okay? But in those who use bleaching cream is directed to reduce the concentration of melanin within your body so that you can live lighter. It doesn't mean that the white, the Caucasian, they don't have melanin. They have melanin, but their melanin concentration is lower than those of us who are black. And that is why amongst them we have more propensity of them having cancer of the skin. A lot of them have the different ones, not necessarily melanin. They have freckles. We have the other type of skin cancer, skin malignancy, tumor, not malignancy. skin tumors. But this melanin in our body actually protects us. And we have some bleaching cream that are not good, that actually directed towards clearing melanin. Those are the cheap ones. And they create more havoc than good. We have some bleaching cream that may save partially some good quantity of melanin. Some people still use it. But importantly is that everything that we add on top of what God has done for us has its own deleterious effect in our body. Even the eye pencil, the one that the women use, all of them has one thing or the other that they can cause within our body. Even the food we eat, the water we drink. So it is for us to be able to balance it generally. Thank you very much.
Thank you so much. We'll talk about that eye pencil thing. Dr. Buka. Dr. Buka went to school.
Oh, Lord.
She got a doctorate degree at your university. And she's from the Caribbean. Go ahead.
Yeah.
Introduce yourself.
Hello. Good evening, Dr. O. And believe you me, I listened to you in Bali 2 weeks ago with Auntie Taiwo asking about cranial surgery. It's actually cranioplasty. I wanted to call in and tell you. But anyway, wow. I was listening and this was interesting. Thank you very much, Professor. Two things. In the Caribbean, there's not a lot of pap smear and we still have a lot of cervical cancer. So it's not only in Africa. And when I was working as an anesthesiologist, we find that non-smokers tend to have a more serious cancer because they're diagnosed later. If a smoker just has a flicker of blood, we do a bronch on them. But for non-smoker, the radar is not that high. So by the time they're diagnosed, they're usually more serious. And there's also screening. Do you recommend screening for lung cancer, this CT scan? I met someone, there is a screening at Holy Cross. And I was scheduled to go, then COVID came. I'm not a smoker, nobody smokes around me. But I wonder if you recommend that. And I must part with this joke. There's this program on PFW that talks about being a vegetarian, you cannot get cancer. So today somebody called in and he said, I was a vegetarian, I got cancer. So they said, oh, maybe you're stressed out and it's the stress from inside. He said, I was living my best life and I still got cancer. I eventually said, call us privately. So do you recommend all this vegan and vegetarian diet? And Dr. Luo, congratulations on your award. I'm so happy for you. Thank you. That's all I have to say.
Well, thank you. Thank you. Like I've said, cancer, if you want to talk about it, is multifactorial. There is no one particular thing that we can say can cause cancer. So if you say you don't do this, you can't get cancer, nobody can confirm. We have people who practically do not do anything and they still have cancer. We have people who do every bad thing and they don't have cancer. So it's multifactorial. It is likely you cannot pin anything to it. Those who will get it, they will get it. The only thing we need to do is to modify our lifestyle, ensure that we do not have higher risk, and we should do the proper test so that if it's coming, we can quickly get to know and get it treated, and we live a good life. We have so many questions on lung cancer. Sincerely, I left lung cancer out because I wanted to actually talk more on cervical and breast cancer. But sincerely, amongst the women, those are the two highest causes of death worldwide: lung cancer and cervical cancer and breast cancer. Though cervical cancer in many developed countries has been downgraded because of proper screening and proper way of quickly taking care of them. Lung cancer is now coming high for women too. Like I've said, because many of them have started taking to smoking and other exposure that they have in the new industrialized world, if I have to use that.
Thank you. Thank you so much. Brother Dan, Emma or Ima? Kindly unmute.
Good evening, all. My name is
Good evening.
Daniel, and I'm calling from Atlanta, Georgia. This is my first time of actually being blessed from this career constituency of mine. Thank you so much, Prof. And I must say thank you so much to my own alumni, Dr. Aluya. This is the second time I interface with Dr. Aluya. And anytime he speaks, I'm actually being blessed from it. So thank you all for being here. My question is this: understanding the topic, reducing cancer in women. What is your advice, Prof, to maybe Dr. Aluya also, to the women? We believe in moderation. Like you said, everything in excess can cause anything that would be actually debilitative to your health. It's applicable to all walks of life. So my question is this: you see some women, especially the African women, somebody has spoken about trying to lighten up your skin to look good and all that. There is nothing wrong with that. But doing it in excess, like, if you're actually going out, some of us that have wife here, we know when you are going out with your wife or things like that, after using so many perfumes inside, that will come also inside the car, every windows is rolled up, and then they are using this perfume, not one, not two, not three different kind of perfume on them. And we know that any irritation on your airways will actually stress up the cells, and the cell begin to react to it, and cell will multiply and things like that. So what is your advice? And if you are actually diagnosed with one cancer, it's already a risk factor of another cancer. So it's a multiple and cascade of problem when you begin to subject the cells to all this kind of stress. So what's your advice to our women?
Well, thank you very much. The truth about it is that for every country, we have the Drug and Food Administration that controls whatever is used. And if we have to trust them, they will have to subject us to everything that is used. And I want to have that assumption that those things that are being used on the body are supposed to be free of carcinogenic agents. However, like you have said, we need to do a lot of things in moderation. But some of the bleaching cream may not be bad. We have some that are very cheap, but they are really bad. So I tend to want to err on the side of caution, that we should be careful to enjoy our melanin and enjoy our black, which has been adjudged one of the best of skins everywhere in the world. So if we are proud of it, we shouldn't be doing that. Thank you very much.
Thank you. Thank you so much. So, Sister Susan, Auntie Susan Oshifade said, thank you, Prof, for the enlightenment on this very familiar disease. After menopause and uterus removal, a female does not get the pap smear, right, sir? And then the second question is, what age bracket will it no longer be necessary for a mammogram? So after menopause and uterus removal, here it is said, that most women don't need, pap smear.
That's not correct. We have what we call vault smear. Okay, when you remove the uterus, the end of the vagina, you have to close it. And in that area, we have some cells that can also become cancerous. So they still do vault smear. But by and large, most women, when they are approaching 60, 65, once they have had negative up to that time, by 65, they don't need to do pap smear tests. Why? Because if they now have a precancerous lesion, it will take another 15 years before, 10 to 15 years before it can naturally become a cancer. And at that stage, if they are 65, another 15 years is like 80. So most times they don't worry them again, they just observe them. So I can say that usually around 65, 70, most women do not require pap smear tests once they have a negative report before then. For mammogram, we have said that most Caucasians tend to have CA breast anything after 50, and it increases with life as they are growing older. So I still look it up to 70, 65, 70. If they are still negative, they may not need it again. But it is important that anybody who is after 50 should be having mammogram fairly regularly, so that any time that there is any echo density that could point towards being a cancer, it can be quickly picked and treated.
Thank you. Thank you so much. Dr. Aluya, you have
Yes.
Yes.
I think
okay.
somebody wanted to say something.
Wait, Dr. Aluya, ladies first.
Yes.
we have to bow to the women. So go ahead, Dr. Buka.
Yeah, just one point. We were doing laparoscopic supracervical hysterectomies. Those people still have cervix, so they still need a pap smear.
Ah,
yeah.
Thank you. Thank you. That's excellent point. Yeah. Thank you. Dr. Aluya.
Yes, so thanks. And thank you, Prof, once again. Like you said, reducing the burden of cancer in our women. Understanding who we are, where we come from, what is this that is affecting us as a people as we evolve all through. And I'll take it in two prongs. One, those who live back home in the continental Africa, and for those of us who moved here, a whole lot of things have changed. When you live here and you left home and moved up here, the temperate region, the food, the climate, everything changes. And again, epigenetic, it changes the risk for everything. And we've known that certain diseases the incidence rapidly increases when you move from one location to another based on the age. For instance, MS, multiple sclerosis. If you move here when you're 15 years younger, before 15 years of age, you acquire the same incidence of those who were born here. But if you move here after 15 years of age, the incidence is like those who live in Africa. So if we found that in MS, it also occurs in other diseases as well. Now, and that's why for those who migrated, who live here, we need to pay attention to a lot of things. But one of the most paramount things that we must pay attention as we work hard to reduce the burden of disease, one, what you eat. I always say that all the time. We are Black. Your grandmother and great-grandmother were used to inyo and cassava and whatever. Listen, do those things better than anything else, rather than eating cheeseburger and all that your DNA does not understand. I often say it as a funny way of saying it, but it's just a fact. Eat the food that your DNA recognizes. And because it takes a while for you to adjust to the environment when you grow up. Your children may do better. However, huge thing as well, as we live here, we tend to gain weight across board, men and women, because of our sedentary lifestyle. And like Prof said, the more weight you gain, the higher the risk of obesity, the higher the risk of cancer. So to reduce the risk of cancer, it's explicitly known. Exercise, exercise, exercise. I forgot the percentage that exercise will reduce your risk of cancer, period. There's no double talk about it, no bargain. So you have to have an exercise regimen every day. I tell my patients, and some of you have heard me say that, let your heart race at least once every day. Every day, just do something that will make your heart race. If you get up from bed and you do sit-ups in bed or run jog on the spot, something that make our muscles move. Because again, we're Black, we're different, our muscle fibers are different from everybody else, and that actually reduces the risk. So food, exercise, but then look for your primary doctor. You have to have one where you sit on a daily, on at least once a year, reviewing your risk for cancer, from breast to cervical and everything else. You discuss that, including other diseases. Now, and that's the third point in time where, as you sit with your doctor, Dr. O will know that as well. One of the questions we often ask, your mom and your dad, are they alive? Yes or no? If they're not alive, when did they die? Why did they die? Was there any risk of cancer? Because cancer runs in families. It really does. There are disease entities that predispose people to have cancer across lane. So these things are true. So you have to know your family history. And one of the things we don't do in our community, we don't share family history. You know, your brother has some issue or something going on. Oh, it's voodoo. No, it's genetics. Please know, and then share it with your brother and sister. We live in the most developed world country on earth. I don't know where this voodoo issue or witchcraft or whatever. And some of us still profess Christianity or Islam or whatever we do. And we go to church every day, and yet we still go behind, still think voodoo is an arrow pray. I'm not saying those things don't happen. They do. Now, again, for those who live here, stress is a big issue. As we have lived here, and women begin to take up a whole lot more, but across board, the incidence of cancer in women has increased. And it's not unrelated to, especially those who move from one direction, you know, from low socioeconomic status to, you know, or countries to these countries like this. Stress is a big issue as they take up the mantle of leadership, of ownership of homes. That stress that is produced and the food we eat, they are pro-inflammatory. So you find out that Dr. O knows, if you take across the inflammatory markers in each and every one of us right now, compared to those back home, ours are usually very high because we constantly stay in a stressful environment and pro-inflammatory state. Those two huge risks are big risks for obesity, big risks for cancer as well. So, and that's why, coming back in closing, exercise takes away stress, it reduces your risk of obesity, it reduces your risk of cancer. Thank you.
Thank you so much. Thank you for that addition. Auntie Tower, did you, okay, you did raise your hand. Okay, go ahead.
I just want to support what Dr. Buka said about the cervical cancer, that even after the uterus has been removed, they can still do pap smear and all that. It's the same thing with the mammogram. You can't use the age. Over 70, and I've been doing mammogram. Even after 70, I continuously do it. The one for this year, I'm doing this next month. So to say 70, you still have to do it, the needful to be alive.
Actually, here, I think it's said that you should do it till 75, actually. And it's every other year, because you have to consider the risk of exposure to radiation that actually directly causes cancer. So that's why, you know, the standards were changed to do that every other year. But the American College of Radiology would disagreed with all other colleges. they said you should continue to do it every year. So, but it's still 75. So this is our son who I want to say, Oladokun Faduyile, kindly unmute.
Thank you very much, ma'am. I've been enjoying the presentation, and it's looks like I'm becoming an expert on cancer based on what I've heard so far. As a husband, this is my question. I know the topic is about reducing cancer in women. As a husband, a father of a daughter, and also still have a mom and a sisters, how, as a husband, how can I help my wife in reducing cancer or preventing her from having cancer? What can we men do to help, especially the women folks?
Prof.
Well, thank you. As a man.
Excellent question.
To guide against cancer of the cervix, stay with your wife. That's the first thing, because the more you go out, the higher the risk you give to that woman. Stay with your wife. To guide against and ensure that she does a pap smear test. Be part of preventive measures. And for a man, also anybody who is over 50 should also go and do a prostate cancer test, so that it's not only for men, but for women. And anybody who is over 50 years, both men and women, to go and do a colonoscopy to guide against a future colorectal carcinoma, to see if person has what we call polyposis coli in the intestine. Again, for the cancer of the breast, you can help to palpate your wife's breast. It's many times they advise the man to help palpate. And one thing that they have found out is that
is it palpation or sucking?
I'm going to sucking now.
Okay.
One thing that they have said is that sucking of breast also help guide against breast cancer. So you can help your wife also to suck from time to time, so that you can help her save her from having cancer of the breast. But don't suck when she's breastfeeding, otherwise the baby can start fighting you. That's on a jocular level. But you can help do the palpation, and it has been proven that sucking also help. I don't know how true it is, but I've had that too. Thank you.
On the forum, Sister Matilda also said reducing her stress will help her, meaning that you don't be a stress of her. And Abby was asking to explain, stay with your wife, please. Do you mean no promiscuity? I believe that's what you mean, right?
Yes, I think I've explained that before, that one of the risk factors is a woman who has multiple sexual partners. And again, another one is a woman who has a spouse who has multiple sexual partners.
Yes.
So if the spouse can now remain faithful and doesn't have multiple sexual partners, it's also helping the wife.
So my sister Monique said, keeping the bills paid on time. So fantastic. And I just want to seize this opportunity to thank all the men on the platform tonight, because, you know, when you see the topic, some men will think, oh, this is for women. No, you have mothers, you have sisters, daughters, and so it's never a topic for men. But I praise God for our Medical Mondays family. Anyway, they will come. And regardless, and we participate together. Olatomi said, does telecommunication mast cause cancer or aid cancer. The telecommunication mast, I think.
The wavelength of what is transmitted from telecommunication mast is about the same with the type of wavelength that you see in a telephone. And research has been shown that they are still within safety level. So it has not been proven that they are purveyor of wavelengths that can be cancerous.
Thank you so much. That is a very important question. And, I've always wondered about that. Thank you. Attorney Richard Williams said, very informative presentation. Thanks, Dr. Faduyile, for your excellent presentation. And Adebola Adetunji said, thank you, Professor Fad. I like that. For the well-seasoned and enlightening presentation. Kudos to you, Dr. O, for the great medical talk. And so this is something that was said here, that this is one of our sisters in DC said she daily processes workers' compensation program. The workers are heavily compensated for cleaning products, dust, coal, and a host of chemicals, including mercury causative agents for lung cancer. So all of these agents, Prof have talked a lot about the environmental factors also. And Mr. Benjamin Olorunfemi said, he thinks we need to keep up an awareness campaign on more of our people using bleaching substances on their skin color. But there were responses to him on the platform. You've talked a lot about that. And our sister in DC also said yes to Dr. Faduyile on cancer and the environment until recently banned smoking in closed office environments and public buildings. We have not accounted for those involuntary exposure to secondhand smoking before the ban, especially our work and public spaces. Well, that would be a tough research to do. Brother Taye Doherty from California said, what is the relationship between albinos and salt and melanin? Albinos, salt, and melanin.
Well, the albinos, they have what we call albinism, and the albinism that they have, they don't have melanin in their body. And I have not seen the effect of salt particularly. I think it's just one of the superstitious things that we talk about that I'm not aware. But I know that they don't have melanin, and that one tend. Well, we have different type of albinos. We have the one that has oculo that also have melanin incontinence in their eyes. Okay, and we have different levels of albinos. So, but they don't have melanin, and they are exposed to having many of these skin cancers. But for salt particularly, I don't know the relationship.
So Abby said, awareness is needed for the bleaching. She's talking to Ben now. The awareness is needed, but we'll need to tackle the root factor of colonial mentality, that is inferiority complex that makes our people feel that being lighter in the skin tone is more beautiful. And, somebody commented again, wow, to perfume use. Perfume use is okay. I believe, and we have not associated perfume with cancers yet. And Abby said, Dr. Faduyile, any thoughts on hair products such as hair coloring in relation to cancer? That's a good one.
It depends on what is used for the hair coloring. Many of them have heavy metals, and some of the heavy metal, when they are absorbed on the surface of the skin, they can cause not only cancer, some other diseases, like some of them can predispose to other diseases like psoriasis and other, not psoriasis, other skin diseases anyway. And I think it depends on the chemicals that they are using. Some of them are cheap ones that has a lot of impurities, chemical that can be injurious to our health. But the very highly refined one may just be good, but I don't have, it depends on the type that is being used.
I think when they don't have, is it phosphates or something, they're good. And it does say, I can't remember the element, but I'll try look it up, that those ones are better than the ones that have it. So Abby says, Prof, exercise, right? How do you explain the cardiac arrest death of someone who attends the gym religiously?
We have different types of exercise. We have exercise that are injurious based on your makeup. And I think it's good for you to know that when we are talking of exercise, they are low caliber exercise, that you need to understand how your heart is. If any of us now have to run a sprint race, and it is as a result of an emergency, I can tell us that by the time we are 400 meters, 200 meters, some of us will drop down because our heart has not been tuned to. But we need to do exercise little by little, know the status of your heart, the status of your body. It should be gradual, but not serious, strenuous exercise. We don't need that for you to be in tune with your body. And that is the type of exercise we are talking about.
Thank you. So Abby, yes, Auntie Tawa is over 70. A couple of years ago, I was at her birthday. She is over 70. So Dr. Luya said, it is clear on research that mothers who breastfeed their babies have a lower risk of breast cancer. It also helps the uterus to regress back after childbirth. Yes, thank you, Dr. Luya. Prof stressed that earlier also. Our brother Taye Doherty said, what is the relationship between prostate cancer and sex, as this was a big discussion on Arise TV last week? That's a good one.
The prostate is an organ that produces what we call dihydrotestosterone. And it's this testosterone that makes a man to have libido and also help in producing the spermatozoa. And the prostate also produces some other chemical that also make this spermatozoa to have fluid, okay? And it also provides nourishment to the spermatozoa so that when it goes, it can stay for some time. And a lot of people had this view that anybody who has more sexual intercourse tends to have bigger prostate because it is expected that it works more. And I think it is largely unfounded, because if that is the case, we have some nuns or people who are not supposed to be not supposed to be having sexual intercourse, they still come down with prostate. So there has not been any scientific evidence to relate sex or sexual intercourse with either prostate hypertrophy or prostate carcinoma.
But does it help not to get prostate cancer? As there are any studies that have shown that, you know,
I'm not aware of any studies on that
we don't
yet.
have relation. Thank you. Dr. Izugu, welcome, bro. Kindly unmute. Yeah.
Yeah, greetings all. Thank you, Dr. Dayo, for that presentation. Really, it's almost like we should have moved this to next month as a women's, health month and really discuss these issues. But I wanted to comment on the exercise part. Exercise is very important for the body and the heart. Yes, people can drop dead when they're doing something, but if you have any concern, you can get, evaluated, get some basic testing, get some stress tests with a cardiologist or something, and then grade your exercise. But don't let the fear of something happening with you doing exercise stop you from really getting into an exercise regimen, and then gradually build it up. Okay, thank you.
Thank you. That is an excellent point. And people who drop dead exercising, they have things that they have that you probably don't have. They have underlying medical reasons. You always need to do that. And stress testing is amazing to help you know, because that would be the cardiologist doing it. Thank you. And well said from our cardiologist. Dr. Izugu is a cardiologist. Thank you.
Thank you.
Sister Wumi Kamsin from California said, great presentation, Dr. Faduyile, thank you. And Oladokun Faduyile, Mr. Oladokun Faduyile said, we need Prof to present one on men. Kudos, Prof. And guess what? Abby Concord, he said, bright idea. So many men are afflicted or affected by prostate cancer, diabetes, and the likes. So, Prof, we're going to have to bring you back. And, despite the fact that you are in the midst of campaigning and all of that, we bear that in mind so that we'll move it up forward for a time. But you have to come back to come talk to our men also directly about, things that affect them, especially in the cancer arena. And Moses, I think this person is on iPhone, said, how reliable is the Cologuard? So I don't know if Cologuard is used in Nigeria. Do you use Cologuard?
Well, I'm not.
You're not a GI doctor also, yeah.
I'm a pathologist.
Cologuard is very, very reliable. I use it in patients who are scared of going under anesthesia and doing colonoscopy. It is right on point. But I tell them that if it's positive, then they have to have the colonoscopy and, have the polyps removed right away. It's a cure. When you have colonoscopy, if you have polyps, they are removed immediately. And that is a cure. I had to repeat that. So don't be scared of colonoscopy, but for people who are scared, I do the Cologuard and it's right on point. It uses your DNA to figure things out. So, Olurati said, apart from lumps in the breast, what are the other signs that one can look for in women to be sure you don't have cancer or that they don't have cancer?
Well, Olurati is my wife. It's the one asking the question.
Our first lady. Welcome.
Well, the mammogram is the most ideal thing, and I think it's important for us to re-emphasize that mammogram, by the time you are 50 and above, ensure you do it. It's having more sensitivity and specificity than even breast self-examination.
Well, that's true. If all of a sudden somebody who is not breastfeeding starts having leakage, especially bloody leakage in the breast, in the nipple, then you need to check that out because it could be cancer. Yeah. And examining, self-breast exam, I don't know if you can see me better. I don't know. I've been trying to position. You want to put your hand this way okay? That's to stretch the muscles of your chest when you do that. And, you know, okay, I'm going to do this one. And, you know, you start with the bone over here and use the, you know, like Prof said, your palm, the tip of your palm right there, you go down deep in your chest and you go up, you know, you go up, go down. Wait a minute, this way, you go that way, all the way down. You press deeply. If there's a lump, it will roll off on the tips of your finger in that palm area. You go all the way around and then you go into your armpit and do the same in a circular manner, because the first place that breast cancer will move to, if it occurs, is under the armpit. So you check and then you squeeze the nipple to make sure there's no discharge. You know, like I just said, if there's discharge, especially bloody discharge, you want to get that checked. Even if it's milky, it could be a thyroid problem, okay, but you still need to get it checked. So those are signs, and it's important to do that monthly. I'm sorry that I showed that, you know, men, it's a women's talk partly. So, so I, you know, I wanted to show how to do that.
I think it's good for you to still say it is not done with dress on.
No,
it should
yes.
be without dress.
Thank you. It is not done. You cannot feel a lump with clothing on. So you want to do that lying in the bed or in the shower is another place to do it. When you lie in the bed, it helps you actually to put that hand real back to be able to stretch the muscles of your chest. Yes, Mr. Oladokun Faduyile, you can unmute.
Thank you very much. I just want to have a follow-up. I know there was a discussion earlier that's sucking of the breast can help. Is there any time if during that process is this normal for a fluid to come in if you're not breastfeeding, and would that be a sign? I just, you know, based on what you just said, and if something is discharging and you're in the process of doing that with your spouse, is that something that needs to be raised?
Dr. Prof, do you want to answer that or should I answer it?
Do answer.
I should answer, okay.
Yeah.
So yeah, in the process, whether it's with your spouse or the woman is examining herself by herself, yes, it needs to be checked out. Like I said, if a woman has a milky discharge, it could be thyroid problem. It could be cancer. If it's bloody, that is more concerning that it could be cancer. Yeah, so it needs to be checked out. See, we do very well when we catch things early in medicine. When we don't, it becomes dicey. So that's why we you know, you will see everybody's emphasizing, you know, catching it on time, because we do better when we do that. So Abby is asking, how do you differentiate between a cancerous lump and a lymph node? It has to be taken out. That's for experts to do. It's for Professor Faduyile, that's what he does. He would, you know, examine those lumps under, you know, microscopes and all, and would, you know, let us know. Abi, am I right?
Very well. I see my microscope on my table.
Oh, wow. This is impressive. Oh, wow.
So it's an office. That's what I do.
Wow. Well, again, I've got to say this. Everyone on this platform, we've been listening to Professor Dr. Dayo Faduyile, who you can tell is a wealth of knowledge and passionate also about protecting us. And if we're talking about things now, everything we talk about is the state of Nigeria, but our vice president for NAPAC, for the national vice president, you've met Dr. Aluya, you've met Madam VP. Our vice president just raised his hand. I've got to shut up. Kindly unmute, sir. That's Mr. Lawal, Mr. Yomi Lawal. He's a national vice president at NAPAC.
Good evening, Dr. Faduyile.
Good evening, sir.
Thank you for sharing your wealth of knowledge with us. Very much in appreciation. Especially at this time of the day, I know it's about 3 o'clock in Nigeria.
Yes.
Yeah.
Really appreciate you. I have a little question, just to get a clear understanding on my part. About the, pardon me, ladies, the sucking of the breast. What good are we doing to the women if you are sucking the breast, there's no milk in there? Is it the sucking or the massage? What is the effect? How effective it is when there's nothing really happening?
Well, thank you very much.
Wait a minute before you answer. Mr. Lawal, it's part of romance. The woman.
I know, that's separate. Romance is one thing.
The woman enjoys it.
It's a duty. We are saying that do it. We're not talking about romance now. We're talking about health issue. So okay. I want to know: is it just romance, or we are actually helping health-wise? That's
Mr. Lawal is such a scientist.
Well,
kindly take it over, Prof.
The truth is that, although I may not be totally sure, but every impulse has a reaction within the body. Okay? If you touch the body, you feel the body, and there is some impulse, there is some innervation that goes around. The act of sucking helps in initiating some sensations, some innervation that is getting some cells to get shed, that may help some cells to get quote and unquote excited and can actually clear some cells that are not good. It's still the same thing that when you have a woman who breastfeeds for a long time, it helps save them from having cancer. It means that it looks as if there is some clog and it is not cleared, so to speak, colloquially, it's not being cleared. It can actually cause some form of stress that can lead to cancer. But the truth about it is that these are causal relationships. Causal means they have found out that they are related. We may not be able to explain the totality of how it has come to be, but it has been found that they are related. They call it causal relationship. So it's not everything that science can explain, but it is good. It's good turning for the husband, it's good turning for the wife to get the breast sucked. And I think it's also vice versa too, because man can also have cancer of the breast. So they can also help for men too.
So women can suck the men's breast too?
Yes, too.
Thank you very much.
Thank you, sir. We can't hear you, Dr. O. You are mute.
I am so sorry. Thank you. Thank you.
Okay.
I was asking for Dr. Veronica. Dr. Veronica Ofuebune.
Yeah, good.
Dr. Veronica.
Hello.
Okay, Dr. V.
I'm soaking in this. Hi.
Hold on one second, because I see Sister Rosemary as her hand. Sister Rosemary.
Okay. Thank you, darling.
Sister Rosemary.
Thanks for the great presentation. So is there any other way to suck the breast without a human being if you don't have a partner?
Prof.
We are not saying sucking of breast has a medicinal effect. We are saying he has a culture. So if you are not having partners, it is not advised. It's not as if that someone will just say, well, sucking of the breast has a medicinal effect. No. It also helps in guiding against cancer of the breast, but it is for those who are having partners. Let me put it that way.
Right. Thank you.
Thank you. So Dr. Veronica Ofwegune is a chairperson at NIPA California. She had written on the platform that this is new. A medical doctor and a potential state governor. Awesome. A win is hope for the nation. And I read that and I'm like, oh my gosh, I have to keep this, you know, because our country is in a state. And yes, God would help us because we are praying. I have no doubt, but he's going to use people. He's going to use us. He's going to use people around amongst us. I'm always grateful when we have people who are bold, who are tough, who decide to, you know, give so much to run for office.
Yes.
I'm always grateful. I am grateful to Professor Faduyile. You see the wealth.
We're so grateful that you shared somebody like this. Every time we have unique situations like this, it just strengthens everybody. Thank you, Dr. O. Thank you, Prof. A lot of education tonight. And I think what stands out, like Mrs. Campson said, is that early detection that you highlighted today. Thank you. Thank you. Thank you.
Thank you. And so my sister asked, when is the election? You keep announcing it. She said, I keep announcing it. So, Prof, when is the election?
Well, we are going to have the primary selection in, I think, mid-April. It's about 6 weeks away.
Okay, that is fantastic. I posted his website, www.ondodayo. I kept looking at that thing, Ondodayo. It means Ondo now has joy, now has happiness. You know, that's his name. And that's what it brings to Ondo. It's very significant. You know, names are very important to us. And that really excited me. I want to share something, and I want to just say, you need to talk to everyone who is, who you know in Ondo State, or, you know, to vote for him. Is the way, one of the ways that we are going to make a difference in Nigeria. We have to change the status quo. And that's one of the ways we're going to do it, to put men of caliber, men who have the passion for us. You can see, you know, very passionate about health, very passionate about everything. He was the advisor, I put it up there, to Governor Akeredolu, who just passed, and we see the amazing things that he did. I want to quickly share this because this is part of our health. Medical Mondays is about health. What is going on in Nigeria is affecting so many people, health-wise, mentally, and this is all part of it. We need to change the status quo. I want to share this. I hope that I'm able to do it successfully. Can you see my screen? I know it has, God knows, a lot of other things that it doesn't need to have on there. Let me
see. We can see it.
But I don't know why it has all these other things there. Okay, so I'm just going to start. And oh, I wonder why it's not loud. It was very loud before. I blame this on Dr. Ajagbe because when I was trying to practice it, it stopped me.
It means the audio was not shared.
So you have
If
to
you
share
click,
sound.
you have to share the sound.
What do you mean?
If you click on more,
More where?
under the
More over here. Then what?
Yes,
Share
ma'am.
computer sound?
Yes, ma'am.
Okay, it wants password. For which one? I didn't need to do this before.
Yeah.
No, it doesn't need your password.
It doesn't need it.
Just
Maybe
click OK.
click cancel.
I did this. Everybody heard it. I actually disturbed their conversation. Prof, can you share it? Do you have it to share?
Well, I think if you make Oladokun the host, you can share from his side.
Okay, let me stop sharing here. Now, how do I stop sharing?
Just go to share screen
and just
click on it.
Click on it. Yeah, you stop and stop
It
sharing.
stop?
You,
No?
once you click on it, you say stop.
Oh, I see it. You know, I've shared screens so many times and I never had problems. I don't know why I messed up on that one. So let me find Oladokun here again.
It is, ma'am. Anybody can share. Because
okay. Can you share?
Like I can see the opportunity
you...
to share. So the person can go ahead and just.
Okay.
Yes.
Can you share, please? So while he's doing that, Sister Wumi comes and said, well said, Dr. O, early detection is key for cancer. And Nene Yen said, wonderful, thank you so much. Dr. V said, outstanding session. Thanks, Dr. O, for amazing Professor Faduyile. Thanks. See, we had the volume now, but not the Sister Matilda said, can single or unmarried women then who are not breastfeeding breast pump for health reasons? Breast pump. I don't know. Prof?
No.
No, breast pump has no.
Okay. So Sister Olutoyin Fekoya said, thank you so much for all this information. I appreciate you. Somebody private chatted me and said, let's go home to campaign for Prof, door-to-door canvassing to get out the votes. So, Brother John Otto said, thank you so much for all the information shared. Sister Sharifa said, thank you, Prof and Dr. O. And I think we're ready for our video. Go ahead. Thank you so much. Thank you.
Wish you success.
Yes. So when, I know that during presidential campaigns, we activate people in Nigeria who are in that area to go vote. Asking that we all please contact everyone we know in Ondo State to vote for Dr. Faduyile. Is going to improve our country. I don't know if you know, I just found out that Akure in Ondo State just have their airport. And they're working on a lot of other things in that state. He's instrumental in that because it was their regime that did it. So it's instrumental in that. That's progress. Thank you so much.
Can I say something?
Yes, please.
We are not doing general election yet. We want to do the primaries. It's still largely intra-party. The general election will come in November, but it is the person who wins at the primary, in April, that will be the candidate, and we take the flag. So we are still going to plead with our people so that they can talk to members of APC, especially not to the general public yet. And all sorts of people that we can talk to too, who also appreciate it. I needed to say that so that we don't think it is general election.
Yeah.
Thank you very much.
What, like you said, what do we need to do for the primaries to get the word to people who need to vote for you at the primaries?
Yeah,
so in our caucus.
It's still by and large intra-party affair. Members of my party, APC, are the people to talk to majorly. It is not yet for the general public.
Okay.
And if we know some one or two people who we know that they have the connection, they have the directions to help in propagating this within the party in Ondo State, which will be highly appreciated too.
Fantastic. So Dr. Salewa Olafioye, kindly go ahead. You are unmuted already.
Thank you so much. I'm calling from Detroit, Michigan.
Welcome.
Hi, thank you. I wanted to know from the panel, what is it that we could do to help Dr. Faduyile, because it's an election and there's a whole lot of things that we could do to augment his campaign in terms of resources, flyers or banners. Does he have a campaign office, or do we have his information? Thank you so much.
Thank you so much. Thank you. So, Dr. Faduyile or Oladokun Faduyile, one of you need to answer that question for us. I guess that was my question. I didn't ask it properly.
Well, if I could, thank you very much, Professor Salewa, for the question, and also Dr. O for this wonderful opportunity and the platform. And I think the wealth of information Professor Dayo has shown, and the dream that we all have about how we want our nation to be, Nigeria, on those days, the integral part of our nation, and how we dream of making our place a place we can be comfortable with. Early presentation of our health, trying to make sure that we have fully well endowed infrastructure that we can be proud of, and also engaging our people. For this, at this moment, some of the things that he has said is, this is pretty much intra-party at this moment, but every opportunity that we have to talk about somebody from the state, regardless of if they're party member or not, because one information to the other also help propagate this message. And just like every other thing, if there's any way you want to support, either by donating to help the campaign. Professor is strictly civil servants who is doing this to change the narrative of our people, who want to make sure that our states become a a reference of a good center for healthcare center. So for you to support, either through reaching out to people at home, or you want to donate, or you want to, put some of this flyer on your status or on your website, either Twitter or Facebook, any opportunity that you want to help is highly welcome. And like you said, the website is ondodayo.com, www.ondodayo.com. So if you go there, there are a lot of information there. If you want to volunteer to help, send some of the information out. If you want to send some flyers on those states to help, if you want to donate in kind, that will also be appreciated. The account information is on the website. The volunteer form is on the website. And if you have to have a way of also motivating him and sending message of support is also there. So we really appreciate everybody. So this is not the right platform, but our goal is collectively as people, we want to make Nigeria a better place. And that is the ultimate goal. Regardless of where you're from, either from the east, the north, it doesn't matter. Our goal is to start from somewhere, and starting right now, based on what he has put in place, is starting from Ondo State. And we can gradually change the narrative of our dear country for the better. Thank you.
Thank you. Thank you so much. I can't believe. Thank you. Our writer, she also helps other people write, says, thank you very much, Professor Faduyile. We are proud of you. Many of the questions here can be found. Okay, many of the questions here Professor wrote can be found on the website, www.ondodayo.com. And Brother Taye Duarte said, congrats for offering yourself for service, Professor. Abby says, the good doctor already has a gubernatorial look. I like that. It does. It does. So you prayer warriors, that's what you do best. Please start praying. And I got a private chat that we have to help. Let us organize fundraising. So I guess dialogue will go in between there. And Sister Ethel said, Dr. Ethel Isiano Mutual said, thank you so much, Dr. Faduyile and Dr. O, for an excellent and informative presentation. And Dr. Veronica had posted this, if I can copy it, the HTTP, I don't know. Dr. V, you know this.
That's ondodayo.com. That's his website.
Yeah, put it in the general.
Oh, sorry, I thought I was in the general. Let me do that.
Yeah. And somebody already is saying they come in that they will support by talking to people on ground in Akure, that they are traveling home in the next few weeks and they will be there to give you support. I guess that's a private chat. That.
Oh.
So thank you so much, everyone. Prof, without much ado, everybody knows on this platform, we dialogue to prevent disease entities before they happen, but we don't establish doctor-patient relationship. We give free information. And so to conclude this session, kindly give us your parting words. You're coming back to come talk about men.
Well, thank you very much. I think importantly, the purpose of this discussion is to see how our mothers, our wives, our daughters live good life. I pray we don't know anyone who dies from cancer.
Amen.
It is a very harrowing death. Very, very harrowing. you is better thought than imagined. And we have to do everything within our means to prevent it. Let us take this news to our wives, to our aunties, to our parents, to our children, that we can get them off from passing this very terrible state. And at the end of the day, they will still die. The emotional wreck, the financial wreck, and the final loss cannot make anybody be happy. That's why I think we have to plead with everyone to ensure that these two cancers, that we have a way to nip it in the bud. We must do everything to get it done. Thank you very much.
Thank you.
Dr. O, you missed my goodwill comment for Dr. Prof.
Oh,
I'm not sure if intentionally did
oh,
that.
wait a minute. Oh, no, I won't do it intentionally. I try hard not to miss anything. I'm looking for it. I still haven't found it.
Still DE there, DE.
DE?
Under that, after Prof is already looking like a governor.
Oh,
right there.
So, okay, after
The comment from someone that said, Prof is already looking like.
Yeah, the good doctor already has the gubernatorial look. And then
immediately after that.
Immediately after that, what is after that on the group chat is Adiola Atekoja, www.theondodayo.com, the website.
Okay.
The message is not on there.
Oh, okay.
It's not even private chatted to me.
No, it's Sunday. Okay.
It's not on there. Can you please repost?
No, what I was saying was that we need people like Prof who understand the impact of stress on the citizens to lead at this time that Nigeria is already stressed.
I agree. And I'm sure, you know, if not 100% of us, majority of us on this platform agree with that.
Thank you very much.
Thank you. God bless you. Thank you. I don't know why you didn't post though. It's not on the platform.
I can see it there, but maybe for some reason, no problem.
Can anyone else see it?
No, maybe it's not open.
Can you see
It
it?
could be that maybe you sent it to somebody directly, because sometimes if you send it
sometimes it's sent to someone
so you
else
might
and not
check
on
who
the
you
platform.
sent it to. Yeah, maybe not to everybody.
Okay.
Nobody is seeing it. It's not here. You probably private chat with somebody.
Somebody invited me to this. Maybe I send it to that person.
Oh.
But I'm reading every chat that is on this. And that's where you saw me. You saw me first of all when I actually raised up my hand. So something must have gone wrong.
Yeah, you were probably private chatting some